Hello everyone, welcome to my channel. So in this video we are going to see about the psychology and sensation part 2. So psychology and sensation. First thing is behavioral dependency. Most of our brain is directly depend upon our all the five senses which tell us. So the five senses include vision, hearing, taste, smell and touch. So sensation is defined as the function of the senses and which is purely resulting in physical stimuli operating our nervous system and the sensory process and transduction. So how the senses are transmitted into a stimuli. So sensory channel. So each system is a channel consisting of a sensitive element connected by nerve fiber to the brain or to the spinal cord. And transduction, this is the process of converting physical energy into a activity within the nervous system, and it is also converted into the electrical potential. So receptor cells convert physical energy into a electrical voltage which is called as receptor potential. This eventually triggers the nerve impulses and this reaches to the brain and it gives us a signal to act for the stimuli. And systematic of a sensory experience. So there is many stages or sequential stages. This is experienced as sensory part and it follows a specific path. The first is physical energy. The next is transduction at receptors and receptor potential, generator potential, nerve impulses, patterns of nerve activity in the nervous system, and the sensations. Then absolute threshold. So each sensory system has its own threshold. So the minimum intensity of a stimulus, whether it could be light, sound, or the vision, which affects the sensory system, so required to arouse a sensation is absolutely a threshold. Next is factor influencing thresholds. So how this affects our sensory systems. Expectations and motivation. One is more likely to detect a stimulus if they are expecting to hear or see it, which is there will be a normal set of threshold. Like if the volume is 50%, it should be in 50%. If it goes more than 50%, it causes damages to our uh, yes. And coming to age and gender, women often will have lower threshold for most senses than the men. Younger people generally detect stimuli at lower levels than the older level. Physical state threshold may vary based on the person's strength, tired or well rested, and they can change significantly during the illness. And different thresholds. So magnitude of threshold, it's just there is a minimum for detection. There must be a certain magnitude of difference between two stimuli to the distinguish one from the other. The JM is just noticeable differences like we can see. So that is this is known as a different threshold. And variability, the threshold differs based on an individual physical condition, interest, and the kind of stimuli presented in the stimulus. Then coming to the cutaneous, olfactory, and gustatory system, skin, the somatosensory system controls the sense of touch, pain, pressure, cold, and warmth. Coming to olfactory, which is smell, it neuron generates impulses that travels to the olfactory bulb, and then the brain gives a signal of smell. And taste. This occurs when the substance reacts chemically within the taste buds of the tongue, which gives a four basic tastes like sweet, sour, salt, and bitter. Next is vision and hearing modalities. The retina contains rod which is responsible to pass the lights or to feel the light sensation. Coming to the hearing, the sound wave is converted into the nerve impulse when it touches the eardrums, then it is transferred into the signals. Then sound, the communication, hearing is the principle. sensory modality for the human communication and language. Kinesthetic and vestibular senses. Kinesthetic provides cues to our movements and maintains smooth actions. Disorders leads to the failure to control movements. Vestibular senses like monitoring equilibrium and awareness of the body position receptors are located in the inner ear. Coming to the disorders, it results in nausea, dizziness, and inability to maintain the posture. And the main nursing implication is the environmental sensitivity. Nurses must be alert of malfunctioning of sense organs, which the patient may find moderate lightning and nauseous irritating. Safety and protection. Patient with loss of skin sensation requires special attention when, for example, when diabetes patients mostly may not have the sensations in their leg and hands. So, we should play a very important role in that when we are giving care. Supportive care such as order should be controlled via ventilation, regimes is required, protection from fall, appetite can be improved, and with good mouth care and appetizing for presentation. Whenever we present a food, the first we see itself, it should be appetizing, then we can eat. So when the taste is not there, we can present it in this way. Thank you.